Hello everyone, have you ever thought about your kids? How do you keep the dental health of your kids and why is so important? I have an amazing, very good friend, Dr. Payne, that he's been talking about avoiding the sugar. And I wish I have taught this kid that I'm gonna talk about it, about why it's so bad to give sugar to the kids. After all, the cavities appear after the sugar appear in the world. And why this is happening? Because bacteria digest very well the sugar, then replicates, and during the replications, there's a liquid, let's say that they go pee-pee or poo-poo, that is gonna destroy the teeth. So this is a type of for us of a mixed denture. But why is mixed? Because we have the two centrals, the two laterals, the canines of the kids, the canines on the lower side, and then every quadrant, like I teach a brushing technique, has the same teeth, a central, lateral, canine, and this is the first molar of a child, second molar, but this is the permanent tooth that comes out of the 6 years old. And they were asking me, what happened when my kid lose a tooth? Every time that your kid lose a tooth and the permanent teeth are coming out, if you don't place a space maintainer, the teeth are gonna collapse because they're gonna try to get a support on the side and they will close the space that they should be covered. So if you have a tooth missing here and here, the teeth are gonna start collapsing and they're gonna close the space. So the permanent tooth that wanted to come here is not gonna come. And the best example of this that I was really traumatized about this case, this is a real life case of my practice, is when my nephew says to me, you know, my best friend have a lot of problems with his kid and he doesn't trust anybody but you. And that was really nice. So they flew from Pennsylvania, I think, and they come here and bring me this x-rays of her kid. If you look at this is the anterior, the upper anterior teeth, and these teeth are very important, the canine, to preserve clean because the permanent are already coming. And if the kid has a trauma or has a problem in this tooth, it's gonna affect the permanent one that is coming. The same with the lower. The lower teeth come before the upper. And if you see here, these teeth are pressuring and causing resorption of the bone, and that they destroy the bone, but it's bone resorption, to let the space for the teeth, the permanent teeth, to come up. That is why it's very important the parents and the kids understand that the trauma or any problem with these teeth is gonna affect the permanent teeth. Sometimes the mother says, oh, it's just a primary teeth. It's not important. When I saw this kid before, I was really impressed. Why? Because the kid comes, imagine this cavity. This cavity that you can see here, this is a normal tooth. But look at this tooth. This is one of the primary teeth because the premolar is coming here. Look at the amount of cavity. This kid ended up having a root canal here, and then they have to place a crown. Sometimes we can avoid the root canal and protect the nerve here and place a crown. So I talked to the pediatric dentist because I did not want to deal with putting the kid under anesthesia. The mother didn't want to, but the kid was not easy to manage. And then this girl, which I adore, destroyed all the wall in this area. The cavity went into the nerve was destroyed. And the problem here is not only the destruction of this tooth, but that this is gonna affect the permanent teeth. And this is when this tooth is extracted, this tooth is gonna start looking for support. So it goes this way, and this one is gonna go this way, and the space for this tooth is not gonna exist. And it creates a big problem. Orthodontists, people, pediatric dentists can fix it. However, in these cases, it's very important the patient has a space maintainer. But what is the best to do? Avoid giving sugar to the kids. But if they want to have a candy, let them brush immediately after the candy. If you put that condition, most likely they're going to be lazy and say, no, I don't want it. So if they have this case, what happened, you can do root canal and they can place a crown, or if they think the tooth is loose, they take it off, but then they have to spend the money on a space maintainer. I was very impressed about this case with this kid with the problem, because the mother said, well, it's the primary teeth, maybe it's not important. It is very important. Look how this, the premolar, it's very important tooth in the mouth, is coming up here, is creating resorption of the bone, and is pushing up to get this tooth loose and extracted and have the permanent teeth. If this has a cavity, the permanent teeth is gonna have a cavity. Now we have this first molar, is gonna be the primary teeth that come up at 6 years old. When I saw the full mouth of this kid, I talked to the mother. I said, how can you let this happen? And she's telling me that the father is the problem, because the father allowed the kid to have all these candies. Well, guess what? After I talked to them, of course, they have to get a crown on this tooth, because I did not want the kid to have a trauma, have a root canal. And this one, which was getting destroyed, had to have a root canal. And I think I ended up doing, no, I didn't do a root canal, but they ended up doing a root canal because it was really difficult to deal with a kid. And I'm a very good friend of this family, so I didn't feel comfortable, right? But I killed the parents in a way that they have to brush, because it's very unfair. Look at this, a cavity on the upper tooth. This is a primary tooth. This is a primary tooth. It's full of cavity, full of bacteria that is terrible for the kids. And this one start getting already a cavity. So the best way to avoid all this for your kids is that you do, like in this case, they ended up doing what is called a pulpotomy to save the tooth from a big infection. But then after this, they have to put a crown. Every time they do a treatment, in this type of patients, like this girl that was 4 years old, they have to put it to sleep under either general anesthetic or sometimes nitrous help. But she was extremely nervous patient, and she was adorable. So for me, it was very difficult, and it's better to send it to the specialist. That's the only thing they do, pediatric dentists. In this country, I work with several pediatric dentists. One is Dr. Goldberg and Goldenberg, and I really send this patient to him to treat the girl. And they have to do a very invasive treatment to keep the kid in oral health and the dental health and the body health. So now that we know how they're gonna brush the kids, remember, I give a technique, but the kids have an easy way. They just have to do like they're scooping out by quadrant. Start with the upper right, continue with the upper left, and they go down. And then on the lower left, go like this. And this is the technique, very soft. This toothbrush is good. However, they have a smaller toothbrush, and they have a very funny with different movies for the kids, Transformers or any image, and the toothpaste. But this is the best way. They're gonna do 6 times to the up, and then this time goes down, especially here. They go down, they finish, and then they bring the tongue out, and they gotta brush it up. And the parents have to floss the teeth of the kids in the way I teach in, and every single episode I have a shorts and teaching how to floss. But for the kids, until they're 9, 10, sometimes until they're 13, they get very independent. Then they can do the flossing themselves. But before that, you parents are the responsible to do it. You wanted to bring the kids to the world. Be sure this kid is gonna grow up healthy, not only in the mouth, but the overall body. I hope that you like this episode, and if you have any questions, be sure to send us a text to YouTube, Instagram, TikTok, to any social media, Facebook. Thank you.